Hi, I'm Dr. Keshav Malhotra and I'm the Lab Director of Rainbow IVF Agra. So generally when we speak about IVF clinics, what we basically understand is that it's the clinician that's doing all the work and not much focus is being paid on the embryologist who works behind the scenes. Now in this video, I'm going to tell you a little bit about the responsibilities of the embryologist. The embryologist is basically the one who is going to check whether your gametes are in the correct order. So they're going to check for the sperm quality, they're going to check for the egg quality, they help the clinician in choosing the embryo to transfer. They also follow up about all the remaining embryos that are there. So they freeze the embryos, thaw them. So there's a lot of work that goes on behind the scenes which not many patients come to understand. One of the major responsibilities of the embryologist is choosing the right gamete. So as you know that the male produces a lot of sperms, there are millions of sperms that are produced, but out of those millions, it's just one sperm which is used to fertilize the egg, especially if you're using a technique which is known as ICSI. Now, this is the role of the embryologist to choose the best morphologically normal sperm and then inject it into the oocyte in the correct fashion so that it results in a good embryo. Now, there are times when we have multiples of embryos which are being produced, and out of those embryos only two or maybe even one embryo is transferred into the patient, and then again it becomes the job of the embryologist to choose the right embryo so that embryo results in a pregnancy. The remaining embryos that are there have to be frozen, and it's a very specialized technique which is used by the embryologist, which is known as vitrification, which is done for these embryos so that they can be frozen for later use, and you can actually store these embryos for as long as you want as of now. Apart from that, there are a lot of diagnostic tests that the embryologist also does, like DNA fragmentation for the sperm, a lot of morphological assays, sperm vitality, etc. So there's a lot which goes behind the scenes. So whenever you're visiting an IVF clinic, always check for the credentials of the embryologist. Always see whether the clinic has an in-house embryologist, and that might help you in choosing the right IVF center.